My dear students, today we will be taking up another of the important classes, and our focus of discussion today would be one of the important types of anemias and what we call as hereditary spherocytosis. Now, you have to differentiate between different types of anemias, and you have to remember the characteristic feature of different types of anemias, say sickle cell anemia, say pernicious anemia, say iron deficiency anemia, say megaloblastic anemia, as well as this special type of anemia. Now, as far as hereditary spherocytosis is concerned, two things: heredity and spherocytosis. So, heredity, inheritance, and usually the type of inheritance which is follows is autosomal dominant, and spherocytosis would just refer to certain specialized cells which are more or less spherical. Now, hereditary spherocytosis comes under the classification of anemias which are basically hemolytic anemias, and these cells, which we call as spherocytes, are having high osmotic fragility, and that high osmotic fragility practically causes them to behave abnormally. And what is important in them, the membrane stability is not there. You have to remember that in the RBC membrane there are these important proteins, and one of the most important proteins is the ankyrin, and after ankyrin there's also this protein called as spectrin. The ankyrin spectrin ratio is very important, and any alteration of this ratio causes the cells, instead of normal shape, to assume spherical shape. Now, what are the important proteins which can be affected in hereditary spherocytosis? This question is very frequently asked, and you have to remember that the spectrin I mentioned, ankyrin being the most common protein having the defects in hereditary spherocytosis, as well as you have to remember protein 4.2, protein 3, and pallidin. So hereditary spherocytosis can be as a result of problem in the cytoskeleton of the RBC membrane as a result of defect in any of these proteins. Now, what is the problem with those spherocytes? The problem with those spherocytes is that instead of the normal flexibility which the RBCs have, once these RBCs assume the spherical shape, they are more rigid, and this increased rigidity makes them less deformable. They cannot adjust to the capillaries, flow through the capillaries, and they are retained in the small sinuses, especially in the splenic sinuses, where they get trapped. So it is very important that the cells do not assume, the RBCs do not assume a spherical shape. Now, how does a patient present? Basically, this clinical scenario would come to you as a child having features of anemia with hemolytic type associated with gallstones or leg ulcers, with cells showing increased osmotic fragility. So questions of this sort, and you have to remember that this hereditary spherocytosis may present with mild to moderate anemia. The hemoglobin levels would be moderately decreased. In addition, the patient can present with splenic enlargement, splenomegaly, as well as jaundice as a result of hemolysis. In addition, the patients may present leg ulcers and pigment gallstones. These can be feature of hemolytic anemias, and hereditary spherocytosis happens to be a hemolytic anemia, and the features would be like that. Now, what can be the diagnosis? How can we just arrive at the diagnosis of this hereditary spherocytosis? So, I mentioned you first of all the anemia, hemoglobin levels would be moderately decreased, and in addition to that, the MCHC would be elevated, and characteristically the MCV would be decreased. Then you will be having those spherocytes, which are basically seen in the PBF as well. And these cells are usually smaller, circular or spherical, more or less spherical, with central pallor, but they are hyperchromatic. So you have to remember the characteristics of spherocytes, that they are smaller cells, more or less spherical, with a central pallor, but hyperchromic as well. Now, bone marrow would typically show erythroid hyperplasia. The osmotic fragility tests would suggest increased osmotic fragility, and then the autohemolysis test would be indicative of hemolysis. Then you have this estified glycerol cross-timing test, lysis test. Estified glycerol lysis test is important for hemolytic anemias. It is not specific to hereditary spherocytosis, but it is positive in other cases of hemolytic anemias. In addition, you have to remember that this hereditary spherocytosis can be complicated by aplastic crisis. We are already aware of this virus, parvovirus, and the strain of parvovirus is B19, and it can precipitate a crisis which we call as the aplastic crisis. And patient can present with fever, with infections, and multiple other symptomatology. So you have to remember that hereditary spherocytosis patients can present with parvovirus infection in the form of aplastic crisis. You have to remember that splenectomy happens to be curative in case of hereditary spherocytosis. And in addition to that, after splenectomy, you have to remember these OPSI, overwhelming post-splenectomy infections caused usually by streptococcus, and you have to give penicillin prophylaxis as well as vaccination, especially against pneumococcal vaccines, so they form a part of post-operative regime in case of hereditary spherocytosis. I hope that I have just mentioned the spherocytosis, and you have to remember all the points I mentioned just now. In addition, I would just like you to draw your attention to the fact that you have to be pretty focused. You have to be diligent as well as intelligent. You have to keep your focus and not go astray. You cannot be taking the help of too many textbooks, too much matter, because in the end you will not be getting adequate time to revise. So your preparation should be well planned, well focused, and I hope that my educational videos would be of immense help to you, as has been feedback from most of the students. Thanks a lot.